Hello, everybody. I'm Lee Cade. Welcome to VINI. It's a VTV production, and we're continuing our look at the world of nursing, especially as how it impacts Valley Behavioral Health. We have three special guests today: Andrea Jackson, who is an APRN with Valley's SRS program; Dallas Bowles, APRN with North Valley; and Christian Judd, who is an APRN with Valley's Forensics program. Thanks so much for taking the time to talk with us today.
Thanks for having us.
So the 600,000-pound gorilla of 2020, which in itself has had a whole bunch of fun little surprises for us, has been COVID-19. COVID's kind of changed everything. I know all four of us are working out of our respective homes. That's a major change. How has it changed your programs?
I think the biggest impact has been for Andrea. So maybe you should start.
I will tell you what a roller coaster it's been. In some ways, I forget that we are all frontline in managing and dealing with COVID and working in long-term care. I am losing many, many clients to coronavirus. I probably lose one or two a week.
Oh, goodness.
There's so many buildings, throughout Salt Lake County. And I think what it's taught me with this and dealing with people with chronic mental health issues that are in long-term care and how the community treats them as a whole and has treated them for the decades they've wrestled with this. And what I wish that the general population knew is that these are people, that their lives are no less valuable because of their age. And I cringe whenever I hear people say, well, yeah, but they were 85. I can tell you the thing that I run into over and over and over again every single day is trying to help these people in long-term care who are really bearing the brunt of losing so much because of this. Before COVID, the things that kept people going was bingo, trips to Walmart, and seeing family members. All of that's gone. All of that's gone. Family can't come into the building. They can't congregate. They can't go out. So we're left having a discussion of how long is this going to last? What's the point of continuing going on? And whenever I lose a client to COVID, especially when they've had some really debilitating mental health issues like schizophrenia or bipolar disorder, and they've been in the long-term care system for a long time, and they die of something like coronavirus, and I know most people are writing them off. I think that they've spent most of their lives being written off and forgotten by the community at large. And we try to, hold space for the lives lost and discuss, visits that we've had with them and what they meant to us in the visits that we had. And then I just try to communicate that to family members of we can hold space for both. The clients I take care of can be struggling just as well as my family members who are sad that their kids can't go to prom and everything. And it doesn't have to be a game of who has it harder or who has worse. It's just trying to open space and create a wider space for empathy and love for everybody. And that's really painful because the amount of pain that's around, I think we all want to just close in.
Right.
And at some point, we can just reach out. I think that's what I think the only thing that's getting me through it.
That's got to be hard because sometimes you see the news or you see comments to news stories. And if you're in an older or more vulnerable population, I imagine you start to feel a little bit disposable. Dallas, what have you noticed?
With the Closero Clinic, I have to be more mindful with my clients. They're immunocompromised a little bit. And there are some studies showing that because they're on Clozaril, they're at greater risk for developing COVID. So I have to be a little bit more relaxed on my clients' labs. So I let them go every 2 months. But if they're below a certain neutrophil level, I tell them no, you have to come in regularly. Otherwise, the risk versus the benefits analysis doesn't line up as well. With that being said, that's probably the biggest one is just I have to relax on my labs. And some of my clients, they're really sick. People with schizophrenia sometimes don't like to be assessed. That's part of their disease process is they want to end the session early. And so I have to redirect them verbally over and over. Hey, I only have a few more questions, 3 or 4 more minutes. And a lot of times they'll just hang up on me versus it's a lot difficult versus encourage them not to leave my office. But it's easier just to hang up a phone than it is to, walk out and leave. And then I can send someone else after them. But here it's just me calling the phone back up and say, hey, let's reengage. It's just a phone click away.
And Christian, have you noticed any big changes?
Not that it's anything close to what Andrea experienced and continues to experience, but there was definitely an uptick in anxiety. that occurred, as well as some depression that continues to occur because people are being told that this isn't going to end anytime soon, that the way things are now is this new normal that we have. And I think that that's been the greatest impact on the clients across the board, is not knowing when this is going to end and what will happen if and when I do get COVID. And so navigating that has been somewhat difficult, but still manageable because, especially with Dallas and I, where our training included psychotherapy. So we have a lot of knowledge and some skill in that area. So we can talk about different ways to cope with these problems and help them understand that it isn't going to last forever, and that we have different ways that we can cope and do activities and such that will give you some sense of normalcy. That's one thing that's been nice, and is being able to have that training to couple with the medication piece.
Yeah, I want to just reiterate what Christian said in what the struggle sense. Really, our role is medication management in Valley, that when you're up against people who are dealing with real life stressors, that probably is a very normal response when all of your coping skills are all of a sudden disappearing as far as being with family and things. At some point I say, what's that balance that medications are really going to help this, and what is just a normal response to the overwhelm? So you're assessing function, you're having a discussion of where does therapy fit into this and where do medications fit in. It would be nice if we could cut it really easily.
That's the most difficult thing, is there's no cut and dry answer. Everybody is different, and that's why we provide specialized treatments and recommendations for each of our clients, which it's challenging, particularly in the populations that we serve where they're vulnerable. We have a lot of serious, severe mental illnesses that we treat. It makes it difficult to navigate, but having all these different resources at Valley definitely helps.
Absolutely. You need to address it as a team and collaborate together.
One of the things that I find personally frustrating with COVID right now is how many people don't believe the science. They're disregarding the statistics. They're not wearing masks. Now, you are working with people in vulnerable populations with some profound illnesses. How is this affecting you?
I'll say this generally, we were definitely aware when voting various elected officials' responses to coronavirus, because I think it's a needle as far as what matters to, as far as my family does with coronavirus. At the same time, I can totally, feel your angst, because I do this all the time. I get really wound up and frustrated. And then I come to this place when I step back and I realize that we all have a way of coping with really stressful situations. And denial is part of this process of grieving what we lost and trying to cope with the unknown. What I see is people are just really afraid of the unknown. And that's where conspiracy theories become really comfortable. That's where dismissing it becomes really comfortable. And, if I hadn't been trained like I had been, and if it wasn't right in my face, I don't know where I would be. I don't know where I'd be. So I try to breathe, know that I need to have compassion for as many people as I can in that moment.
How about you, Dallas?
Well, I knew COVID was going to come over here. I was watching the YouTube videos in China. I actually bought like over 100 masks before they were like a hot thing to have. So I knew it was going to come over. I was prepared. I had food. I had everything. So personally, I think part of this is just due that I used to work for the university hospital, and I would go from room to room to room, and I would have 6 different clients. One would be a trauma, one would be a quadriplegic, one would be urology, and giving nursing skills to those clients wasn't the difficult thing. The difficult thing was learning to deal with the personalities and the different types of family dynamics to deal with. That's the thing I didn't like about nursing at the very beginning. But once I've learned how to deal with those different types of stressors, because one would be like a trauma I'd walk into, the next one would be like more pain control. So over time, I've learned to deal with these types of stressors. And so I found just doing small little things has really helped me in the long run. And like some of those things is I dance every week with my wife. I do dance classes. I go hiking every week. Self-care is the most important part of my life right now, because what that does is just propels me forward to not, I guess, feel collapsed around me. And so that's what I've done. And I do it with my wife. And that really makes a big difference when I have someone else there to do it with. So that's how I handle it, is I have to do more self-care than I've ever done before in my life.
Right. It's a catalog of self-care I think a lot of us are becoming very familiar with. Christian, how is that affecting you and your job?
In my job, not as much as in my personal life. So my wife has significant asthma, moderate to severe asthma. And the cold that was going around earlier this year, like January, February, it took her 2 courses of prednisone and 3 different antibiotics to get her well.
Jeez.
And I've had people say, well, she probably had COVID. She did not. I mean, the symptoms are not the same at all. But because she was so sick, it scares the heck out of me that if she were to get COVID, that she would at minimum end up in the hospital. And so when I see people saying that it's fake, it's just the flu, it just frustrates the heck out of me. That's what my biggest frustration is. We never ran out of supplies. We were able to get masks. We never ran out of toilet paper. We didn't hoard toilet paper like some did. But, you know, even I went to Costco yesterday, and after the alert came out last week, people are starting to hoard toilet paper again. And the shelves are getting low. And it just drives me nuts. Like, nobody's going to run out of toilet paper. No. Nobody. You have this response from people that is either one extreme or the other, and it's hard to find the middle ground. So that's been incredibly frustrating. And my biggest coping skill that I've been working on since this all came into play, and you know this, Lee, because you responded, has been my cooking. I've been honing in on my cooking skills. I've become quite good. I love it. I mean, I enjoyed cooking before, but you know, it's my one hobby that I've been really working on, and I think that the results have been quite good. Many levels. That's been really fun.
I wanted to piggyback on what Christian said about the middle ground. And it is so hard to not go to any extremes with this, but this really calls us to find the middle. And I see that so often. And we also can't jump to the assumption that it's going to be devastating if you do get coronavirus, because I will tell you, I have clients, you know, just horrible diabetes with amputations, chronic respiratory failure on oxygen, and they get coronavirus, and it's like the sniffles. At the same time, I know that there was a nurse in one of the facilities I was at in her 30s with 2 little kids in the ICU. So it is this unknown of, gosh, when you look at the statistics, statistically speaking, you are probably going to survive just fine. Epidemiology is tricky. Like, taking care of the herd of us is hard. But I will say the thing that I've said for months and months and months, I'm not as worried about the mortality, but as the morbidity. Because when you look at the number of people that have to be hospitalized for coronavirus, that is very high. And when you have worked in a hospital, you recognize that the skills, the things like ECMO machines, ventilators, and ICU nurses is very limited, especially the PPE necessary and the rooms, you know, all of those things, they're in limited supply. And so this has probably been the most concerning time for me with coronavirus, when you see these hospital administrators come out again and again and say, we are stretched. Because I know these nurses, I work with these nurses. They're all tough. They do hard things every single day. And when I hear the struggle that they're having, I am more cautious now than I have been ever.
And when you see that they're having to spread out the care, spread out the patients, and having pop-up hospital rooms, one thing that I've said to multiple people after getting into working in healthcare and becoming a healthcare professional, I don't know about you two, but never in my life did I imagine that I would read from a health department that we would have to start considering rationing care. Never in my life did I imagine reading that in a current newspaper.
Yeah.
Let that sink in.
We'll take that opportunity to close out this episode. I do appreciate the 3 of you for taking the time to talk with us today. Next episode, we're going to come back with all 3 of our doctors and talk about the future, because I think it's important that we maybe focus on some more optimistic things, because these COVID episodes always bring everybody down. Thank you very much.